Hi, this is Joseph Pate, better known as Medicare Joe, and welcome to the Medicare Made Simple presentation today. It looks like we have about 150 attendees in here already, so we're going to go ahead and get started and let the other ones trickle in as they come. But the goal of our time here today is to make Medicare simple. Simple to understand, simple to know your options, as well as simple to enroll. So I want you to grab a pen and paper because there's going to be plenty of opportunity to take notes during our session here today. And I want to start with a concept of my experience to bring you through this session here today of, over the years, I have personally dealt with folks that have made the wrong decision with their Medicare and chose the wrong plan. Unfortunately, that created financial hardship for these folks, and it wasn't their fault. That's the thing. There's an old adage, you don't know what you don't know. And I want you to remember that concept as we go through our session here today, because the goal of our time together is to alleviate on any of the unknowns that may be out there, so that way you can make an educated decision on your specific Medicare enrollment. Now, I know you're probably saying, well, Joe, that sounds fantastic, but who are you and where do you come from? So let me give you a little bit of background on myself, and then we'll dive into the actual material. So I've been in insurance now for the better half of 10 years. I know you might be saying, that's impossible with that baby face, but yes, it has been the better half of 10 years. I originally started with group health insurance, helping people from 1 to 50 employees with their company. And then about 7 years ago now, I entered the Medicare space. And I kind of just fell into it through my grandparents, actually. I'm from Rhode Island. My whole family is from Rhode Island, so I will probably never leave Rhode Island. But my grandparents that live right up the street, they were aging into Medicare. And they said, well, you're in insurance. Can you help us with this Medicare thing? And boy, was I in for a treat. It took me the better half of almost a year to understand Medicare. I was watching YouTube videos, attending seminars. I also read the Medicare and You guidebook a couple times front to back, believe it or not. And after about that year's worth of knowledge, I was able to help them through their enrollment and be able to kind of guide them through selecting the right plan for them. And the reason I'm telling you that is because at that point, 7 years ago, I knew there had to be other people like my grandparents that were in the same situation, had no idea what to do with their Medicare. And at that time, I completely came out of the group health business and formed it into a Medicare business, in the sole purpose of helping folks understand how to make educated decisions with their Medicare. So if we fast forward to today, we're now licensed in over 40 states. We've helped thousands of Medicare beneficiaries with their enrollments. And what I've done now is I've created, all of our experience, our time helping people into a 45-minute presentation. I promise I'm trying to keep it under that for you today. That will avoid people from having to go down the same rabbit hole that I did with learning about Medicare. And for anyone that's in here today in this session, I have a little bit of a surprise for you. I'm going to be giving away 2 free bonus items at the end of our session here today. The reason that I'll be sharing them at the end is because they will make absolutely no sense to you if we go over them now. But at the end of the webinar, if you stay to the end, I'll go over how to access those 2 bonus items and what they actually are as well. Also to note, my assistant, Tori, she's going to be monitoring the chat here today. So it is private, but if you have any questions, please feel free to drop them in there. I've made it private to avoid any confusion from other folks' questions as we kind of go through this. So without further ado, grab that pen and paper and let's dive into the Medicare Made Simple presentation. All right, so I always like to start with this screen so that way you can make note of our contact information on here. That number, you can contact us with any questions along with our website here below. There's more educational videos on different things specific to Medicare that you can learn from our website as well. So if you want to take a screenshot of that way you have all of our contact information. And then I like to always start with the steps. And the steps of Medicare being that, and I'll turn my little laser pointer on here now too. These are the steps to a successful Medicare enrollment. I've kind of made this breakdown for people because this is the easiest and best way to get through a Medicare enrollment. Step one, stage one, is always Medicare education. That's where a lot of you are here today, learning the ins and outs of Medicare, how it works, the topic in itself. But stage two is going to be equally as important, and that's getting enrollment advice. And whether it's with us or with somebody else, you want to seek enrollment advice from an independent professional. Somebody that's unbiased to the carriers, unbiased to the options that you pick, meaning they work with them all. But that way you can sit side by side with that person and see if your decision aligns with what they recommend as well. And then the third stage, which is probably the most important stage, it doesn't even actually happen until after you're on Medicare. This is getting lifetime support from the professionals that you work with. Lifetime support, meaning that they provide year-round customer service for your questions. They do annual reviews every single year with you to make sure that obviously your plan is still the best one for you for the next upcoming year. A lot of folks forget about this one, but it's probably the most important one. These two happen in a short period of time when you're getting onto Medicare. This one's going to happen for the rest of your life. So stage three might be the most important of all three of them. But these three steps will allow you to get a successful Medicare enrollment and will also allow you to be happy while you're on Medicare for the rest of your life, especially this number three. So let's dive into Medicare. And before we actually, go over the ins and outs of how these work, we want to understand the parts of Medicare. And I'm sure you've probably seen that alphabet soup thrown around, part this, part that, part A, B, C, D, and E. So there's really only 4 parts to Medicare. And I've listed them here. And really only 2 of the parts actually are Medicare. So part A and part B, your hospital, your medical coverage, this together makes up what is known as original Medicare, where you're insured by Medicare. Part C is Medicare Advantage. This is actually the alternative to Medicare. More to come on how these all work. This is a replacement of Medicare, think of it as. And then Part D, which is your prescription drug coverage, that is going to be a standalone prescription drug product. So again, I'm going to go over how all of these parts work in depth, and we're going to start with original Medicare, Part A and Part B. So Part A, think of that as your hospital coverage. It's going to cover you for your hospital stay. And as long as you have worked a minimum of 40 quarters, so 10 years, or your spouse has, there is no premium for Part A. Part B, that is considered your medical coverage. So I say that's everything else outside of the hospital. Doctors, tests, lab work, etc. Believe it or not, this has a premium associated with it. Some folks, find that hard to believe, but yes, Medicare Part B you have to pay for. It's $174.70 per month. This premium, however, can differ based on your income. If your income is above $103,000 filing individually or $206,000 a year filing jointly, this premium will be incrementally more depending on which income tax bracket you fall into. If you do have an income above those thresholds, we can give you exact premiums. For today, we're going to use the standard Medicare premium of $174.70. If you are already receiving Social Security benefits, then what will happen is you're actually going to be automatically signed up for Part A and Part B. There's no action for you to take. You're going to receive your card about 3 months before your 65th birth month. And that Part B premium, that $174.70, that's actually going to come right out of your Social Security check on a monthly basis. That's how you'll make payment on that. If you are in here and you're not receiving Social Security, that is okay. If you intend to start Medicare, you must take action and actually physically sign up for Medicare. You can do it online at the website I've listed here. You can do it over the phone, or you can do it in person at the local Social Security office. If you're going to delay your Social Security, which will make sense for some folks, then that Part B premium of $174.70, that's going to be billed to you on a quarterly basis. So as opposed to you paying monthly, you'll be paying on a quarterly basis where they'll mail you a bill. And I've done up the math here, so that'd be $524.10 every quarter that you'd pay until you start to receive Social Security. Once you start to receive Social Security, then they'll just take out that monthly distribution from your Social Security benefit. In terms of coverage and when does it actually start? So for the majority of you guys in here today, Medicare will start on the first of your birth month. But Medicare obviously loves to make this stuff complicated. So the only exception to that is if your birthday is on the first of a month, your coverage start date will actually happen the first of the month before your birth month. So I've done out that example here below. If your birthday is June 1st, your Medicare effective date of coverage is actually going to be May 1st. But for the majority of you in here, it will be the first of your birth month. This is very important for some of you that are in here today. If you or your spouse are still actively employed and you are on that group health plan, and there's more than 20 employees that work there, you technically can delay your Medicare enrollment. You can either sign up at 65 or you can wait and you can sign up when you retire later on down the road. Medicare, because you're still on a group health plan, considers that to be creditable coverage for you to delay your Medicare enrollment without any penalties. There's a couple of things to consider when it comes to either enrolling at 65 or delaying until you retire, and I've listed them down here below. Number one is to compare the out-of-pocket cost. Does your plan have a high deductible that you keep hitting every year? Compare the monthly premiums. We know Medicare base premiums $174.70. Does your work plan cost more than that on a monthly basis? Are you taking any high-cost medications? And the reason I put that here is because a group health plan actually will cover high-end medications, brand name drugs, better than Medicare would. And then lastly, this is probably the most important one, is do you have a spouse or any dependent children that are dependent on your group health plan? So you see, when you're a primary of the group health plan, if you were to leave that, then the dependents on that group health plan would also lose the coverage. So if you have a spouse or kids that are dependent on that group health plan and you intend to still work, it might be best just to wait until you retire to start your Medicare enrollment. There might be a few of you in our session here today as well that are on or have one of these special programs that are available: CHAMP VA, TRICARE, VA benefits, or Medicaid, which is the state health program based on income. This webinar today is still good knowledge for folks that qualify for these to gather, but a lot of what we go over today is going to be different for you because you qualify for special programs if you have any of these qualifications here, or eligibilities, I should say. Because it's kind of its own separate program, I don't want to confuse the majority of people in here. So what we'll do for those folks is we will also offer separate consultations for people that have these situations or have these eligibility qualifications for these programs. And that way we can discuss the specifics of the special programs that they would qualify for. But for the majority of you that don't qualify for these programs, we're going to dive into some of the ins and outs of Medicare here now. And we're going to start with the exposures of original Medicare. So there's a reason why people don't just carry Part A and Part B by themselves with nothing else. It's because there's an unlimited liability by doing that. The hospital coverage has a deductible of $1,632 per benefit period, meaning that for each medical event that would occur, you have to pay your deductible. Part B has an annual deductible, but also has this 20% coinsurance. So 20% coinsurance, what that is you're paying a percentage of the bill. So you're paying 20% of the bill, giving you an unlimited liability. So having A and B by themselves never makes sense for somebody to go on. And that leads me to one of my favorite slides in the presentation, is the two roads of Medicare. The two roads, you have either the option to choose a Medicare Supplement plan, also known as as a Medigap policy, or Medicare Advantage, which is Part C. And for folks getting onto Medicare, this is always the first decision that they need to make on which road they want to go down, whether it's Medicare Supplement or Medicare Advantage. So we're going to start there. I'm going to explain the two and how they work on this next slide here. If you want to have that pen and paper handy, I love to do this exercise with folks. Draw a line down the middle of the piece of paper. We're going to make a left and a right side. On the left side, we're going to label that the original Medicare side. And how this is going to work with the supplement is you'd have Part A and B as your primary insurance. You'd have a Medicare Supplement acting as your secondary insurance. And you'd have a Part D prescription drug plan for your medications. And this would be one of the roads, the Medicare Supplement road. The other option is Medicare Advantage. This is also known again as Part C. This would be a Medicare replacement plan. You can't have both of these roads. You have to pick one. So we're going to dive into how each one of these works in a little bit more detail. And first, I'm going to start with the Medicare Supplement option. With the Medicare Supplement option, this is essentially how it's going to break down in simple terms. You're going to have original Medicare A and B covering you at 80% of your medical bills. And you'll have a Medicare Supplement that will pick up the 20% gap in coverage. So what you're effectively doing here is you're paying an additional monthly premium to avoid having to pay any medical bills. There's a lot of benefits to the Medicare Supplement option. I've listed some of those here. Of these, the main ones are there's no large out-of-pocket expenses that you'll incur because you're paying a fixed premium to avoid that. You'll have an open network where you can see any of the doctors that you want to see. You're covered nationwide, anywhere in the U.S., and these plans are guaranteed renewable, meaning that every year they just roll over. You don't have to re-qualify or re-enroll into them. They're guaranteed renewable as long as you're paying your premium every month. When it comes to Medicare supplements, if any of you have opened the Medicare and You guidebook, you're going to see this confusing chart that talks about Medigap plans and Medicare supplement plans. I've highlighted the two, really the only two options that ever make sense for somebody to pick when it comes to a Medicare supplement plan, and that's Plan G and Plan N. And the reason why they make sense is if you look down the columns, these are the only plans that are actually covering 100% of these gaps in coverage. Now the Plan F, if you turn 65 now, you can't buy this plan. So they've outdone the Plan F, and that's why it's not highlighted. But with Plan G, if you look down this column here, we'll start with that. The only thing missing is the Part B deductible. So how Plan G as your supplement would look like is your hospital coverage will be completely covered at 100%. So that deductible would not be required for you to pay. The carrier would pay that for you. The coinsurance is covered at 20% as well, so that's covered. So the only thing you'd actually pay on Plan G, if you had the worst year that you can imagine, is a $240 yearly deductible, one time per year, and that would be it. Very simple to understand Plan G. It is your Cadillac tier coverage. You can't get any better quality in a plan. Plan N on this chart is very similar to the Plan G if we look by the side-by-side comparison. It's still missing the Part B deductible. It's also missing Part B excess charges. And you have these little asterisks here. And normally when there's asterisks, there means there's something more to be had there as well. So with the Plan N, I call the Plan N the value plan. The way that Plan N is going to work is it will cover, just like the G on your deductible for the hospital. It'll cover the 20% coinsurance as well, just like the Plan G. The annual deductible, you'll still have that to pay just like the Plan G. So you'll have the $240 deductible that you pay out of pocket. The difference with the Plan N is that once you satisfy your Part B deductible for the year, if you were to then go to the doctor after that, they can charge you at most a $20 copay at the doctor and at most a $50 copay at the emergency room. So again, you satisfy your deductible, and after that, you'd have a $20 copay at the doctor, $50 at the ER. Let's talk about the Part B excess charges and what is that? So Part B excess charges is if you have a doctor that accepts Medicare but does not accept Medicare assignment, which is the agreed upon monetary value that they're going to be paid from Medicare, they may charge up to 15% more than that Medicare approved amount. So if a doctor, let's say a Medicare approved amount was $100 for a service, but the physician does not accept Medicare assignment, they can actually charge up to $115 for that service. And the reason why I always say that the Part B excess charges really isn't a deciding factor when you're looking at these two is because in certain states they don't even exist. So if you're in any of the states listed here, excess charges do not exist. But the other reason is that less than 97% of doctors accept Medicare assignment, meaning that less than 3% of doctors do not. Nationwide, you'd have less than 3% of doctors that would charge these excess charges. So the net result really is a minimal role in the Plan N when you compare these two. And the reason why I call the Plan N a value plan, if you look at this side-by-side comparison, it's very similar to the G. You have the same deductible. The difference is that you have a $20 copay at the doctor and a $50 copay at the ER once this is satisfied. The reason it's a value plan is because it's usually about $20 to $40 less a month in premium. So if you're somebody that goes to the doctor less than 15, 20 times in a year, you could actually save that premium every month and just pay the copays as you use the plan. So it does provide a little bit more of a value for folks that aren't using their insurance a lot. Let's talk a little bit about the cost and how a Medicare supplement plan breaks down. I'm going to have a sip of water because I'm doing all the talking here today. But how the supplement cost will break down is you'd have original Medicare, the Part B premium of $174.70. Your Medicare supplement premium on a monthly basis does differ based on where you live and a couple other factors, but on average is anywhere from $70 a month to $150 a month for the supplement plan. And then you'd have your Part D standalone drug plan, which I budgeted for about $15 a month here. That one, again, does depend on the medications you're taking, though, as well. But this would be a good breakdown to give you an idea of if you chose the Medicare supplement route, what you can anticipate for a monthly cost. In terms of the best time to sign up, well, we already talked about Part A and B. You're going to sign up for that 3 months before your birth month, right? But the Medicare supplement plan, they allow you to sign up 6 months in advance of your birth month. And what they do is they allow you to lock in your premium 6 months before for your effective date of coverage. So for folks that are looking at a supplement plan, as long as you know which plan letter you want to go with, it always makes sense to lock in the rate 6 months before for your effective date of coverage. You get the cheapest price at that time, it avoids any mistakes, and most importantly, it checks it off your list. One thing less that you have to do with your Medicare enrollment. And lastly here, the Part D drug plan. That would be the last step in this type of enrollment. It would happen 60 days before your birth month. So your supplement would be 6 months before, original Medicare 3 months before, Part D drug plan 60 days before. Now I want to come back to this 2 option slide, and we're going to talk about Medicare Advantage and how this actually operates. So again, these are the 2 roads. If we're back to that original sheet that I had you do that exercise on. Medicare Advantage, this is also known as Part C, and it's the alternative to Medicare. So what does that mean? So when you're on a Medicare Advantage plan, you have Part A, Part B, and Part D, and they lump this all into one plan. So one program, one card for everything. And you're insured through a managed care organization. So you're insured by a carrier through an HMO or a PPO. So for most of you, you've been on one of these programs, either if it was private health care through the marketplace, or it was a group health plan. This is a very similar product to group or employer coverage. The reason I say that is because the way that these programs work is you're going to be paying copays for pretty much anything you use the plan for. Doctor visits, tests, lab work, emergency stays, hospitalization. You pay copays throughout the year as you're using the plan. These plans will have a medical maximum out of pocket, so you'll have some type of liability cap, and usually that's $5,000 to $8,300 a year that they'll cap your copays at for the calendar year. And you'll typically work within a network of doctors and hospitals, so you'll have everything under that one card for everything. Now, there's a lot of benefits to actually being on a Medicare Advantage plan. Most importantly being the cost. So with Medicare Advantage, there's usually no or very low monthly premium that you'll pay in addition to your Medicare payment. Usually it's just the $174.70 and that's it. Your primary care doctor, that also is usually no or a very low $5 copay to see your primary care. It comes with drug coverage. It'll come with dental, vision, and hearing coverage as well. And in terms of plan options, I put a note here at the bottom that says there's a number of different plan options. So to give you an idea, if you've had coverage through an employer during your enrollment window, they'll usually give you like maybe 3 or 4 plans to pick from for that upcoming calendar year. Well, with Medicare Advantage, it works almost the same way, except there's like 20 to 25 different plan variations. And some of the factors that determine that are going to be the doctors that you're seeing. That helps us narrow it down. The medications you're taking helps us narrow it down. And then we look at max out-of-pockets and we say, okay, which ones typically have the lowest out-of-pocket maximum, which would be your liability if you got sick. And then we look at which ones have the best extra benefits built into them. That's the dental, vision, hearing benefits. So with the plan options, it's a little bit more intricate than with the Medicare Supplement being just a G or an N. Where we can dive into all the plans in your area when it comes to Medicare Advantage. The cost of Medicare Advantage, I touched on this a little bit. It's typically just your $174.70 Medicare premium. That's it. Some plans do have additional Medicare Advantage premiums that are assigned to that, but most, if not, I would say 80% of Medicare Advantage plans don't have an additional premium that's attached to them. It's just your Medicare $174.70. In terms of the best time to enroll, well, the best time to enroll in the Medicare Advantage plan is going to be aligned with the Medicare enrollment 3 months before. And why that's the case is because unlike the supplement plan, with a Medicare Advantage plan, you actually need your Medicare card to sign up for the plan. So your Medicare enrollment happens 3 months before your birth month. The Medicare Advantage plan will then also happen the same time because you do need the Medicare card to sign up for a Medicare Advantage plan. Again, unlike the supplement you don't need your card. You can do that 6 months before your birth month. The Medicare Advantage is 3 months before your birth month. So again, this is that slide that shows the 2 roads of Medicare. That is always the first decision that you have to make when you're looking at your Medicare options is, do I want to be insured by the left side, which is original Medicare and a supplement, or the right side, which is Medicare Advantage? To dive into just the benefits and disadvantages one more time, we're going to go through the original Medicare with the supplement route and talk about some of the benefits again. So the benefits of a Medicare supplement plan. There's no network of doctors, so you can use any doctor or hospital that you wish. Your primary insurance is Medicare, so you're actually insured by the federal government. There are no referrals required. There's no or very low out-of-pocket exposure on the plan because there's no surprise bills that come up. That's why you're paying that fixed monthly premium to avoid having to have medical bills with this option. Which also paying an additional premium does classify as a disadvantage when we're looking at these, side by side. That's a disadvantage of a supplement. You do have to pay additional premium every month for it. It does not include dental, vision, and hearing coverage like Advantage does. That requires an additional premium to be added. You can add it, but it does require an additional premium for that product. And it does not come with prescription drug coverage. You have to buy a standalone prescription drug plan. So again, we budgeted for about $15 a month on that last slide for the prescription plan. Now, Medicare Advantage and their side-by-side comparison. Again, there are benefits to Medicare Advantage as well. There is no additional premium that you have to pay. It comes with the dental, vision, and hearing coverage. It comes with prescription drug coverage. It comes with extra benefits like a gym membership, silver sneakers. It comes with that. Over-the-counter reimbursement, which is like a quarterly reimbursement that they give you for health and wellness products that you get over the counter. So it does have its perks in that regard, but it also has its disadvantages as well. And I want to make sure it's known to everybody that we're looking at this objectively. I want you to see the side-by-side of the good and the bad. With a Medicare Advantage plan, the disadvantages are the co-payments that you'd have to pay. So I listed some of them here. Specialist, $35. Emergency room, $100. Your hospitalization, $300 a night for the first 4 to 5 nights of a stay. So if you get in the hospital for 3 nights, that's $900 bill. So obviously, the more you're using the Advantage plan for medical services, it becomes a disadvantage because it becomes costly to do so with the copays. You're restricted to a network of doctors. And then again, you have that $5,000 to $8,300 out-of-pocket maximum every year, depending on the plan, where if you did get sick, that's your liability for that calendar year. But the most important one for people to know of, especially when they're aging into Medicare and they're turning 65, is that for folks that pick and start with a Medicare Advantage plan, they may have to health qualify to go on a supplement after their initial enrollment. What does that mean? So your initial enrollment, getting onto Medicare at 65, or if you delayed and start your Part B when you retire, that's your initial enrollment of Medicare. And when you first start Medicare, you can pick a Medicare Advantage plan or a Medicare Supplement plan with no health questions asked. You're completely approved 100%. However, if you start on the right side with Medicare Advantage, after the first 12 months of your enrollment, you can switch within the first 12 months, but after the first 12 months of your enrollment, let's say your health took a turn, right, for the worst, you have to health qualify to get back on a supplement plan at that point in the future. So with your initial enrollment, that's not required. So picking which side you think is going to be the best, it's important to know this factor because you might be making the decision for the rest of your life. Now, you can always start with the supplement and then go to an Advantage plan. There's no issues doing that. But again, if you start with Medicare Advantage, and then after 12 months you become ill where you're paying copays out of pocket, you now then want to go to a supplement, you will have to health qualify and you might not be able to purchase that plan at that time. I want to do a quick exercise with you here. You're not committing to anything today at all, but I just want you to kind of grasp an idea of which side you think is better for you. So circle which one you think as I take another sip of water here. And then for the folks that picked the Medicare Supplement side, I want you to take it one step further and circle either Plan G or Plan N. And if you are still not sure, that is okay. This is a complex topic, and at the end of our webinar, you will be able to schedule a call with myself or one of our team members here for personal advice on your situation. If you're uncertain, I strongly recommend doing this. Medicare is not a one-size-fits-all product by any means. It is different for every individual. On those calls, we'll go over the bonus items again. As we get closer to the end of the webinar, we're almost there, but I'll talk a little bit more about what those are. But you will be able to schedule a call with one of our team members to get some insight as to what might be the best option for you. But before we jump to that, I do want to go over Part D because we haven't spoke about that yet in detail. And I saved that for the end because it's kind of its own separate type of topic anyway. And for some of you in here, you might be saying, well, Joe, I don't take any medications. Do I really even need to get a prescription drug plan, right? which I understand. But with the drug plans, if you don't sign up when you are eligible for Medicare, or you don't have creditable coverage through like your employer-based plan, and you just forego it altogether, well, when you eventually do sign up later on down the road, you will be charged a 1% penalty for every month you didn't have drug coverage. So that usually comes out to be about $3 to $4 per year you didn't have drug coverage that you'd have to pay in premium every single month on top of your prescription drug plan premium. So for folks that aren't taking medications, I typically say it still makes sense to sign up for a plan. There's plans as low as $5 a month that are out there, and at least you suffice that penalty of having a prescription drug plan. But how the prescription drug plan breaks down is it's another program that works almost in stages, if you will. You have what's called your deductible stage, where you're going to pay for your medications until you hit your deductible. You'll be paying the full amount. When you have a plan that has a deductible stage, if you satisfy that, you then jump to what's called your initial coverage stage. And in the initial coverage stage, you're going to pay a copay for each medication. This is very similar to what you probably have with employer-based coverage, where you pay a copay for each individual medication. Where Medicare gets confusing, again, is that when you accumulate, this is going to be for a higher end medication that people are on, when you accumulate $5,030 a year of medication costs, your plan changes to you paying a copay for the drug to now you paying 25% of the cost of your medication. And you'll do that in the coverage gap stage, which is also formerly known as the donut hole stage, if you've heard that through other videos. You'll do that until you hit your catastrophic limit for the year. And the catastrophic limit is $8,000 for the year. Once you accumulate $8,000 worth of retail costs and medications, you then pay nothing for your drug. You get it for free until the year ends, and then this all resets again on the calendar year, January 1st through December 31st. How we're able to help folks with a prescription drug plan is similar to how we shop the Advantage plan, actually. What we do is we first research. We input all medications in your pharmacy into our plan finder calculator. And what that does is it's going to sort through the 20 to 25 different plan options in your county. And it's going to tell us which plan handles the medications for you the best. We then enroll and help people select and sign up for the plan. But the most important thing here is, again, the annual review. It's important that with the drug plan to reevaluate this each year, because your medications can change each year, and so do the plans change each year. So with the drug plan, they allow you to pick what plan makes the most sense for your medications today, and then 12 months from now, next year, you'd have to pick the plan that makes the most sense for you at that time, and so on and so forth. So the annual review and reevaluating that situation each year, again, is very important to make sure you're on the right plan. I wanted to put this slide up here just to show that we are independent. So here's some of the main carriers that we work with. You'll see a lot of the top A-rated names in there, and there's about another dozen that aren't listed on here that we also work with as well. And the meaning of this is to show you that our position as an independent broker is that we can write any of these companies and truly provide an unbiased and objective outlook on what is the best option for you. So we can write any of these companies. We do not work for one specific insurance carrier. And I want to touch on just a couple of the most common questions that we get asked, so that way we can clear the air on that as well. The most common question: this is all great, Joe. How much does this cost for me to work with you? Do I have to pay a fee for your service? No, our service is completely free to you. Okay, there's no charge that we charge you for this. It's completely free to go about discussing the plans and having us as your broker. The next question that we get a lot is, will the cost of the plans be less if I just go direct to an insurance carrier and kind of cut out the middleman? The answer to that is no. The cost is exactly the same. The premiums do not differ while you work with a broker versus working with the carrier directly. The benefit to using a broker is you have a free advisor in your corner that can kind of map out all of the carriers and show you which one's the best for you. The $1 million question. Well, Joe, you're a nice guy, it sounds like, but I know you're not doing this for free, so how do you get paid, right? Well, obviously, there is compensation behind it. So we get paid commission directly from the carriers for bringing the business to them. So it's a commission-based business that we're in. We get paid no more for bringing the business to one carrier over another. It's the same across the board. And we get paid the same for bringing you the product. So there's no bias to any one carrier or plan when it comes to making recommendations. This, again, allows us to provide unbiased opinions to you. So I want to recap what we went over here today. We've talked about the parts of Medicare. We've talked about the original Medicare exposures and why Part A and Part B is not the best option by itself. We talked about Medicare Supplement versus Medicare Advantage, the two roads. We went over a drug plan. We talked about when to enroll in the different plans. And we talked about why a broker is an asset and have them in your corner. And the next question is, well, where do I go from here? And again, we're going to come back to the steps to a successful Medicare enrollment. And again, you're in stage 1. You have viewed maybe some other online content. You've attended our educational presentation here today. And the next step is to seek enrollment advice. So you're going to notice that gold telephone just popped up there. And this is where you'll be able to schedule your free consultation with one of our team members or myself. And in those consultations, we're going to provide the 2 bonus items that I mentioned from the beginning of the webinar. That is the personalized enrollment timeline, which is a step-by-step guide of what you need to do and when you need to do it for your specific Medicare enrollment. And then the second bonus item is a Medicare cost summary breakdown. And what that is that will show you the exact cost down to the penny of what your Medicare enrollment will look like on a monthly basis. So again, those 2 free bonus items will be available for folks. You can get those by scheduling your consultation by clicking the gold telephone there. And I think that, yes, Tori just put up that link in the chat as well. As I'm going over the next stage, you might want to do that. I know we had about 50, maybe 60 slots available for appointments. So as I go over the rest of this here, you can start to fill that out and book your call. The third stage, again, is that lifetime support. Again, in my opinion, the most important stage of this all. What we provide to our clients is we provide lifetime customer service. Whether it's claim issues, rate increases, common Medicare questions, whether you get a bill in the mail and wonder what it's for. Our team here is helping folks every day with their customer service issues, and we continue to do that for all of our Medicare beneficiaries. And then the second one listed here is the free annual reviews. Although you're signing up for Medicare, now when you turn 65, Medicare is ever changing. Change seems to be constant in this industry. So it's important that on the anniversary of your policies, you're having a conversation with your agent to make sure that you're still in the best position with your plan. So that's something else that we help folks with, is we conduct free annual reviews every single year on the anniversary of their policy. So at this time, we again are in stage 2, where you can click the gold telephone now to schedule your call. I'm just going through the chat here. It looks like some folks have already popped some messages in there. So John said he booked for Thursday at 2. Awesome. Laura says, great presentation. I'm all set for Wednesday at 12. Thank you, Laura. Appreciate that. So again, as you go through that, it looks like some more people are posted in there now. As you go through the gold telephone link, it'll allow you to pick the day and time for your consultation, where we will then provide you the 2 free bonus items along with your personalized consultation on that call. Again, I thank you for joining our Medicare Made Simple webinar session here today. Everybody have a wonderful rest of the week and take care.